بالله الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Today we shall be talking about environmental epidemiology. But before we start this lesson, just a recap of what we did in our last lesson. In our last lesson, we defined what the principle of what environmental health is, the importance of environmental health. Then we also talked in detail about the scope of environmental health. And we also talked in detail about the career paths and the career opportunities in the field of environmental health. Now, in our lesson today, we shall continue and we shall be talking about environmental epidemiology. Now, as we start our lesson today, these are our lesson objectives. That is, by the end of this lesson, you should be able to, number one, define epidemiology. Two, differentiate between incidence and prevalence. Then define environmental epidemiology and describe its scope. Then identify and describe common environmental health risk. Distinguish between major study designs. Compare observational and experimental studies. Explain the difference between association and causation. Then apply basic criteria for causation to simple cases scenarios. Then akhiran, we shall talk about, or you should be able to identify common limitations in environmental epidemiology. So in brief, this is what we shall be covering in our lesson today in the next 45 minutes, probably. Now, number one, before we even go deep, we need to know what epidemiology is. That is a ta'rif. What is the definition of epidemiology? So, epidemiology is the study of who gets diseases, where diseases occur, why diseases happen, and how diseases can be controlled. In simple terms, epidemiology helps us understand patterns. When we are talking about patterns, we are talking about ittijahat. So it helps us to understand patterns of health and disease in our population. Now, let us expand this definition, because this definition is talking about who, where, why, and how. Now, when we are talking about who gets diseases, epidemiology basically tries to help us. So, when you're talking who gets diseases, this involves examining which group of people are affected. So that is at the core heart of epidemiology. Who gets the disease? For example, are they children? Are they elderly individual? Or certain occupation more at risk? So epidemiologists look at factors like age, mathalan, gender, income level, lifestyle, and genetics. So that is the first core area of what epidemiology is. It tries to answer this question: who gets the disease? Then number two, al-makan, where diseases occur. Al-makan alladhi yahduth, where diseases occur. Al-makan alladhi yamridu fihi unasun. So this looks at the geographical distribution, tawzi al-geography. So this looks at geographical distribution of diseases. That is, are cases concentrated in certain countries, regions, or communities, mathalan? So for instance, some diseases are more common in tropical areas, while others may be linked to urban environment. So this is a question that the epidemiologist basically tries to answer. The place where people get the disease. For example, during the time of Corona, where did it start, mathalan, and how did it spread to the other regions? Then number three, why diseases happen, the limadha. So this is about identifying the causes, al-asbab, and risk al-makhatir factors. So this may include مثلا biological agents. Okay, for example, like the time of corona, it was caused by a virus. So we are trying to know exactly why this disease happens. So like bacteria and viruses, sometimes it's because of the environment we are living in, albeit. So environmental condition, mathalan, because if you live in a polluted area or in a place where there is poor sanitation, ماذا سيحدث? You'll get diseases. Then also sometimes it's the behavior, a suluk, like smoking or the kind of foods we are eating. وأحيانا it is all about the social factors, like access to healthcare. So people who have access to healthcare, they rarely get sick. And the opposite is true, al-masakin. They don't have money, so that they cannot access health, they cannot get quality health services, so they end up getting the diseases. So that is why the diseases happen. ثم في نهاية المطاف, the last thing is how diseases can be controlled. So we already know who gets it, the where, the why, but the most important thing epidemiologists basically try to do is to control these diseases such that it does not spread. So epidemiology also focuses on prevention, al-waqaya, and control strategies. And this sometimes can include vaccination program, health education to spread the awareness through workshops, seminars. Then it can also be through sanitation improvement, that is encouraging people to live in clean places, hygiene, screening programs, mathalan, and sometimes it can be at the the governance level. So there can be the government introduces policies to do what? To control. For example, during the time of Corona, there were a lot of policies from the Ministry of Health, the wearing of mask, mathalan, and many others. So this is basically the definition of what? This is the definition of epidemiology. So epidemiology is the study of who gets disease, where diseases occur, why diseases happen, ثم أخيرا, how diseases can be controlled. And this is the expanded explanation of the definition. So this is basically the same thing. Now, so what is the key element, the key concept in epidemiology? And I know you have the background in epidemiology, there are two words that always occur. There are two words that are common in epidemiology. And these two words are incidence and prevalence. So these two words are very important when you're studying environmental epidemiology. Now let us start with the first one. So the first one is what? The first one is incidence. And when you're talking about incidence, you are talking about معدل الحدوث. So what is this معدل الحدوث? So incidence refers to, underline this, the number of new cases, حالات الجديدة, of a disease that develop in a population during a specific period of what? During a specific period of time. Is it clear? So the keyword here is what? Number of new cases. So what does it tell us? So incidence helps us understand the risk of developing a disease. It answers the question, how likely is it that someone will get this disease? Now, the most important thing about al-mu'addal al-huduth, it focuses on new cases. Fakat. This is the key word. It focuses only on new cases. And it is always linked to a time period. Mathalan fi sana aw shahriyan. And it is always useful for studying the causes of disease and identifying the risk factors. For example, In a town of 1,000 people, 50 people develop asthma this year. So the incidence is 50 new cases per year. Now, a high incidence means many people are becoming newly infected or affected. And this may indicate an outbreak, increased exposure to a risk factor, or poor preventive measures. So this is the definition of incidence. So it focuses with the number of new cases, at a given period of time. And the higher the incidence, it means that the danger. The higher the incidence, it basically means there is an outbreak or increased exposure to a risk factor. ثم ثانيا prevalence, which is المعدل الانتشار. انتشار الوباء، انتشار الأمراض إلى غير ذلك. So what is the definition of this? So prevalence refers to the total number of cases. That is the new cases plus the new plus the all cases. معا. It is unlike the incidence. The incidence معدل الحدوث is just focuses with الحالات الجديدة. So prevalence refers to the total number of cases of a disease in a population at a specific point in time or over a period. So what does it tell us? So prevalence shows how common a disease is. It answers the question, how widespread is this disease right now? الآن ما هي معدل الانتشار? So the most important thing is that it includes both new and existing cases. So it is all the new cases. وهناك الحالات كانت موجودة. So it does not always depend on time. So point prevalence equals to على كل حال, it's useful for health planning and resource allocation. So the prevalence or the معدل الانتشار, it basically helps us to do what? To plan when it comes to health planning and resource allocation. مثلا, if 200 people in the same town currently have asthma, okay, so the prevalence is 200 cases. So these are the two concepts that you have to understand, okay, in epidemiology. So we have the incidence, that is معدل الحدوث ومعدل الانتشار. Okay, and this is just explaining the same thing. So this is just the same explanation and how you can calculate it actually. Now, on to the most important thing, because today we are talking, so that was just a background, al-khalfiyya. But now, let us go deep, fil umq. Today we shall be talking about environmental epidemiology, ilm al-wabaiyat al-bi'iyya. So what is the definition of environmental epidemiology? So environmental epidemiology is a specialized branch of epidemiology, because we have different types of epidemiology, right? We have clinical epidemiology, we have analytical epidemiology, we have ila ghayri dhalik. So this is a branch of epidemiology that does what? That examines how, this is very important, examines how environmental exposures such as air, water, chemicals, and climate affect human health. Full stop. So that is what environmental epidemiology is all about. Like how this environmental exposure, for example, if you're exposed to air, is it the air polluted in itself? And is it going to cause a disease? Water, chemicals, are they toxic? The climate, okay? How they affect the human health. So rather than focusing only on diseases themselves, it investigates this is important, external conditions that influence whether people become sick or stay healthy. So environmental epidemiology does not just focus with the disease in itself, but it focuses with al-awamil kharijiyah, okay, that can influence whether the person becomes sick or healthy. For example, if you are living in an hygiene place, you are not going to be sick. But if you are living in a place where there is a lot of al-awsaq or al-biya mulawatha, what is going to happen? You are going to get disease, right? So in simple terms, environmental epidemiology studies how the world around us impacts our health. How al-alam, the world around us, impacts our health. And it can impact us either negatively or positively. So it asks questions like, is polluted air making people sick? Are chemicals in food or water harmful? How does climate change affect disease pattern? So these are some of the questions that environmental epidemiology seeks to answer. Now, what is the scope of environmental epidemiology? That is al-hudud, the scope of environmental epidemiology. So environmental epidemiology covers a wide range of exposures and health outcomes, including number one, air pollution. So environmental epidemiology examines harmful substances in the air, such as smoke, dust, and industrial emissions, because this can lead to respiratory diseases, heart problems, and sometimes even cancer. Number two, water contamination. So it studies how unsafe drinking water contaminated by bacteria, viruses, or chemicals can cause diseases like diarrhea, cholera, and typhoid. Then the chemical exposure. So it focuses on chemicals such as pesticides that are used in the agriculture in farms, heavy metals used by factories like lead, and industrial waste that are emitted, okay, in the water sources that can affect the nervous systems, organs, or overall development, right? Then it also covers the climate change. So it explores how changes in temperature, rainfall, and extreme weather events influence our health, including heat-related illnesses, food. So of course we have some, okay, food insecurity and the spread of infectious diseases. So in general, how does the climate change affect health? Then occupational hazards. So it also looks at risk people face in their workplaces. So when you're talking about workplaces, you have, for example, people working in construction companies, like the engineers. Sometimes they are exposed to chemicals which are toxic. For example, exposure to toxic substances such as noise, dust, or unsafe working conditions, especially in industries like factories, constructions, and what? And mining. Now, so these are the five scope. These are the five scope of environmental epidemiology. So it studies the air and basically tries to check if the air is polluted. Can it affect our health? Number two, the water. It also studies the water sources and water contamination and its effects on our health. Then the chemical exposures. Then four, climate change and occupational hazard. Now, these are just but some of examples of the scope of environmental epidemiology. For example, increased exposure to polluted air. It will lead to what? To lung diseases such as asthma and chronic bronchitis. Drinking unsafe water can also lead to diarrhea. Working in a chemical factory, increased risk of toxic exposure and long-term health problems, including cancer. Rising temperature, so increased cases of heart stroke and spread of vector-borne diseases like malaria. So the key principle is the environment is a major determinant of health. As you all know, when you're talking in public health, we have the determinants of health, and there are very many. So environment is one of them. You also have the education. The level of education is also one of the determinants of health. Your level of income can also be a determinant of what? A determinant of health. Your housing, where you are also living, the food you are eating. So there are many determinants of health. But one of the most determinant is this environment. Now, on to the next part of which is very important. The study designs in environmental epidemiology. So, to understand how environmental factors affect health, epidemiologists rely on study designs. So, these are the structured ways of collecting and analyzing data. So, these are structured way of collecting and analyzing data. When you're talking about analyzing data, we are basically talking about research. So when you're writing a research, there is always what is known as a research design. Which design are you using in your research? Is it a quantitative design? Is it a qualitative design? إلى غير ذلك. Okay, so each design serves a different purpose and helps answer specific types of questions. So we have different designs. So these designs are divided into two. We have the non-experimental, which are the observational studies. Then في المقابل, we have the experimental, which are the interventional studies. So what is the difference between these two? So number one is what is known as the observational studies. And these are the dirasat al-rasdiyah. So in this case, no experiment is involved. It is all about al-mulahadat. We observe, then we record our findings. So in observational studies, researchers do not intervene. There is nothing like experiment. There is no intervention. So they simply observe what is happening in real life setting and look for patterns, association, and possible causes. So there is no experiment. There is no distribution of questionnaires. There is no survey, basically. So here, and the researcher is just observing how the climate is affecting people in a given region. They're just observing, for example, how water pollution affects people. So these studies are especially important in environmental epidemiology because it is often unethical or impractical to expose people to harmful conditions deliberately. So sometimes a dirasat al-rasdiyah many researchers normally use it because unlike the experimental ones, sometimes you normally have unethical or impractical. For example, you cannot give people you cannot expose people to toxic. You cannot give people what's the best example? You cannot, for example, expose people to toxic things just because you want to experiment. It's very unethical. It's very impractical. So sometimes what you can just do, observe, al-mulahadha, then you just write your findings. Now, the observational studies, they're divided into three. This is very important. Number one, you have cross-sectional study. Number two, cohort study. Then number three, case control study. So these three are under observational studies. So number one is cross-sectional study. Okay? Now, when you are talking about cross-sectional studies, this is dirasat al-maqta'iyya. Maqta'iyya means that's a specific point in time. So cross-sectional study It is the opposite of longitudinal study. So longitudinal study, as in you study for a longer period of time. So longitudinal il-mustamirra, but cross-sectional is only at one single time. So a cross-sectional study examines a population, this is the most important thing, at one specific point in time. One specific point in time, and is mainly used to measure prevalence, that is how common a disease is. So it normally answers how widespread is this disease right now. So for example, survey is here. I confused before. Survey people in a city today to determine how many are suffering from respiratory illnesses. I had confused earlier. So you can also have a survey in observational studies. Yes. Is there a question? So for example, survey people in a city today to determine how many are suffering from respiratory illnesses. So when you're talking about survey, we are talking about questionnaires. So you as a researcher, you design 50 questionnaires. Then you go to Mogadishu town, any place, you just start distributing the questionnaires. So you want to know how many people today, al-yawm, how many people are suffering from respiratory illness, full stop. So it is not all about today, tomorrow, after tomorrow, no. It is only today. So the information you are gathering the information at one time, not on a weekly basis, not on a monthly basis. So what are the advantages of the cross-sectional? It is quick and relatively inexpensive. It is a quick way to do what? To gather information. Like you just design your questionnaire. The questionnaires are not expensive. Sometimes even the questionnaires, you can use the Google form to send the questionnaires. Then it's useful for identifying health patterns. That is another advantage. So you can easily know the pattern. Like, is it increasing or is it decreasing? The pattern. Now, what are the disadvantages, limitations of this cross-sectional? So it cannot establish the cause-effect relationship. Then the most important advantage is only provide a snapshot of a situation. So it is a snapshot because you are collecting the data today only. So you want to know like how many people, have been infected with TB, malaria, today only. So it is just giving you a snapshot. So you don't know what will happen tomorrow or after tomorrow or in 2 weeks' time. It is not going to give you that what. You're not going to have more detail. It is just like a screenshot, snapshot. Khalas, full stop. Now, number 2, in observational studies, we have the cohort study. This is dirasatul atrab or al-jama'at. So a cohort study follows min hunaka al-mutaba'a, follows a group of people over time. So this is the opposite of cross-sectional. Cross-sectional does not follow. It is only a single specific time, right? So a cohort study follows a group of people over time to see how exposure affects outcomes. So what it compares, exposed group and non-exposed group. So it basically compares two groups of people. So there are people exposed to pollution, and then there are some people who are not exposed to pollution. So it basically answers this question: does this exposure increase the risk of a disease? So for example, follow factory workers exposed to chemical and compare their health outcomes with office workers over several years. So what are the strengths of this follow-up? So it can establish a temporal relationship. What is the meaning of temporal relationship? It can establish a time relationship. So we can easily compare January and February, February and March, March and April, إلى غير ذلك. So useful for studying multiple outcomes, not only one outcome, but متعددة. Then the disadvantage, time consuming. It's very time consuming. You can imagine it's not like the cross-sectional. It's 1 month, 2 months, 3 months. You need a lot of time, and you also need a lot of money. So may require long-term follow-up. That's just the same thing, time consuming. So it will require you a lot of time to get your final results. Now, number 3 is case control study. So this is dirasatul halat wa shawahid. This is the case control study. So a case control study compares people with a disease cases versus people without the disease. So it basically answers the question, what factors might have caused the disease? For example, it compares lung cancer patients with healthy individuals to investigate their smoking history. So through their smoking history, we can easily get to know, okay, the rate of exposure for those who smoke and those who don't smoke. We are going to compare those two. Now, what is the strength of this? So it is efficient for studying rare diseases. There are some diseases that are not common, just like cancer. Faster and less expensive than cohort studies. If you compare to the cohort, this is cheaper. Now, what are the limitations of this? It relies on past data, which may be inaccurate, then cannot directly measure incidence. So these are the 3 words. These are the 3 designs under cross-sectional studies. Now, number 2, so this is just a summary of the observational studies. Now, number 2, we have experimental studies. So these are the dirasat at-tajribiyya. So you don't have time, we only have 5 minutes remaining. So in experimental studies, researchers actively intervene. There is an experiment, هناك التدخل or control conditions to observe the effects on health outcomes. So these studies are more controlled and can provide stronger evidence for cause and effect relationships. Now, the examples of experimental studies. So provide clean, treated water to one community, while another continues using untreated water. Then compare disease rates between the 2 groups. But remember, we said what? We said this can be unethical. So the experimental studies sometimes can be unethical. It is not like the observational studies, because here you, for example, in this case, you give one group clean water and treated water, but the other group, you don't give them clean water. You don't give them untreated water. Just because you want to do some research. Yes, it's good research, but akhlaqiyan, it's not good to do that. So that is why we are saying these experimental studies, sometimes you have to be very, very careful, because sometimes they can be unethical, okay? but they are the best. They give you the reliable and valid results. So that is their strength, strongest evidence for causation. They give us strong evidence about the cause of a disease. Greater control over variables. You can manipulate, you can intervene. This group, okay, they are using it, and the other group, they are not using it. You can manipulate, but the observational ones, you cannot do that. Okay. Then the limitation, this is what you were saying. There's some ethical concern. Cannot expose people to harm deliberately. Often expensive and complex to conduct. Now, so this is the difference, because this is the difference now between observational. So in observational studies, there is no intervention. You as a researcher, you cannot interfere with anything. You just observe. But in experimental, there is some intervention. So the researchers actively introduce changes. You can, for example, in some experiment, you can increase temperature here and you can reduce the temperature there, just to find the effect of high temperature here and the effect of low temperature. So you can easily intervene. That is the difference between the observational studies and the experimental studies. Now, why somebody can ask, why are this design important? So, because they help us choose the right method to answer a research question. So I don't know if you've done the course research methodology. So it also ensures that your results are valid and reliable. It also guides public health decisions and policies. Then it strengthens evidence for environmental health risk. So this is why we need to use this word. We need to use these designs to ensure that our results are valid, our results are accurate, and that we use the right approach to answer our questions. Now, the last part of our lesson is about causation in environmental health. السببية في صحة البيئية. This is very important. Now, because of time, we only have 1 minute remaining. So when you're talking about causation in environmental health, we normally have two things: association and causation. Okay? Now, association means what? Al-irtibat, and causation means as-sababiyya. So, we have some important things here. So I will send you another link, so that, because these things are very important. So we have 1 minute remaining. So I will send you another link so that we continue for like 20 more minutes. So just be patient. I'm going to send another link after 5 minutes or 6 minutes. I will send another link so that we finish the part that is remaining, because it's very important. The second part, that is the causation in environmental health. It's very, very important. So we will continue after the break. So this link is going off right now. After the link goes off, you'll wait for 5, 6